You've learned a lot about heart disease and the medications doctors can choose for their patients. Who knows? Someday, you might help a family member make decisions about this stuff too. One thing's for sure, you're now prepared to make informed choices that keep your health on track. Before we finish, let's check on Arturo, Brian, and Angela one more time. As you'll remember, Arturo had a close call with appendicitis. Fortunately, the doctors were able to remove his appendix in time. But they made sure that he understood his risks for heart disease. Being overweight with high blood pressure, high LDL cholesterol, and high triglycerides is a dangerous combination. Upon his release from the hospital, Arturo was instructed to follow up with his primary care physician in 2 weeks. Arturo's doctor recommended a diet low in fat, sodium, and cholesterol. He also placed Arturo on an exercise program to improve his fitness. The doctor prescribed a beta blocker to control Arturo's blood pressure, along with a cholesterol-lowering agent to help reduce his risk for a heart attack. Because Arturo didn't have a heart attack and there is no congestive heart failure or kidney disease, the doctor didn't prescribe an ACE inhibitor or an ARB. Arturo started watching his diet and exercising regularly with his wife. When he returned for a checkup 6 months later, he had lost 45 pounds and 8 inches from his waist. His blood pressure had dropped to the high normal range, and his cholesterol levels were improving. They still were a little high, though. What does Arturo think about all this? He says it's been a challenge to adjust his lifestyle, but he feels much more energetic now. And for the first time in years, he's enjoying outdoor activities. He even threw the football around with his nephew last weekend. Now let's check on Brian, who had a heart attack. A follow-up lipid panel revealed elevated levels of total and LDL cholesterol and low HDL cholesterol. Do you think that's what caused the blockages in Brian's arteries? After 3 days in the hospital, Brian was discharged to cardiac rehabilitation. His rehabilitation plan started with a diet low in fat, salt, and cholesterol. It also included supervised exercise and yoga to help manage his stress. And of course, Brian enrolled in a smoking cessation program. You're learning in class how ACE inhibitors and ARBs work to help lower blood pressure by preventing blood vessels from constricting. Brian's primary care physician decided to prescribe an ACE inhibitor along with aspirin, blood pressure medicine, and a cholesterol-lowering agent. After 2 weeks on the ACE inhibitor, Brian developed a persistent cough, so his doctor switched him to an ARB instead. That's a lot of medicine, but Brian has some serious health problems to deal with. And good news! After 6 months, his HDL cholesterol levels have increased, and his blood pressure, total cholesterol, and LDL cholesterol have dropped. Brian has quit smoking, and the exercise and yoga have begun to relieve his stress. These steps, combined with a new diet, are helping him to get fit. Eventually, Brian broke up with his girlfriend, but he was accepted into the master's program he wanted, and he even got a new dog named Max. Most important, Brian is making a full recovery from his heart attack. For the first time in a long time, he feels optimistic about life and about his future. Finally, let's see how things turned out for Angela. She was pleasantly surprised to learn of her pregnancy and relieved that her test revealed no cardiac problems. She was discharged after 1 day at the hospital. The physician there prescribed iron supplements for Angela's anemia, but chose not to start her on any blood pressure medication. Angela made an appointment with an obstetrician to conduct a general exam and begin prenatal care. At that appointment, Angela's blood pressure remained a bit high in the prehypertensive range, so the obstetrician placed her on a low-sodium diet and a moderate exercise program for pregnant women. Months later, Angela delivered a healthy baby girl. Her iron deficiency anemia and blood pressure are improving, but she is still prehypertensive. In place of medication, her primary care physician thought it would be best to control Angela's blood pressure by continuing her special diet and exercise program. How did you do in deciding on medications for Arturo, Brian, and Angela? As you see, healthcare can be complicated, especially when we need to make important choices for ourselves or our family members. Are you ready? For more information about decision-making tools that can help you evaluate the effectiveness of different treatments, check out the websites of the Agency for Healthcare Research and Quality or the National Institutes of Health.